In this lecture we will introduce and employ our novel computational method for elucidating and analyzing the therapeutic and psychosocial effects of arts-based approaches and interventions, aiming to understand how they work, and to enhance their effectivity. Examples of arts-based approaches and interventions are art, music and dance therapies, guided imagery, and other approaches such as writing therapy. Arts-based approaches alleviate symptoms, such as pain, breathlessness, stiffness, stress, depression, fatigue, anxiety and other symptoms. For either a patient or an healthy individual, the engagement with the arts also enhances one's well-being, quality of life and social interaction, and improves one's sense of coping. For example, reduces work burnout and stress among professionals. The benefits of the use of arts are also manifested in psychophysiological measurements, for example, reduction of blood pressure, cortisol levels and heart rate. Benefits are also seen in the increase of serum melatonin in Alzheimer patients and improved balance in patients with Parkinson. Arts-based therapies and interventions are used in diverse populations and age groups, both by patients and healthy individuals. Arts-based therapy has been employed clinically for more than a century, in places such as hospitals, community and rehabilitation centers, education facilities and the private clinic, and has been recognized as a profession for more than 20 years. No wonder it is considered as a non-pharmacological treatment. However, much research is required to reveal the underlying mechanisms by which such arts-based approaches operate. That is, the big questions we face are, how do arts-based approaches work? And how to enhance their effectivity. We will now show an excerpt from a real art therapy session, which consists of three main entities, the therapist, the patient, or interchangeably referred to as the client, and the artwork itself.
It's bringing up a lot of feelings just working this way.
A typical clinical setting utilizing the arts consists of the creation work itself, such as artwork, musical work, and dance and movement work, the therapist and the patient, a three-way relationship and entities therein, all of which constitute a rich and dynamic environment of occurrences. For example, in artwork, these include the starting and stopping of a drawing stroke, the length, direction and velocity of that stroke, color and tool choices, erasures, and more. In musical work, the dynamic occurrences include the beginning and end of a played musical note, the pitch, intensity, tempo and instrument choices. In dance work, these include for example, the temporal positioning of the limbs in 3D space, torso direction, turns and bends. The artistic construction work itself is not the sole component of the relevant dynamic processes, complex social interaction also occurs. A session involves the therapist and patient, their verbal and nonverbal communication, body language, bodily postures, movements, hands positioning, facial expressions, physicians in the room, the therapist intervention, and more. As such, the visual, auditory and bodily information in the modalities of the evolving artistic construction processes are difficult to grasp. This is also true for the social interaction processes in the form of verbal and nonverbal communication involving the patient and therapist. These complex, simultaneous, and interwoven expressive and social behavioral processes are often considered intractable to human observers. And, as a consequence are usually interpreted subjectively and described verbally, thus affecting their subsequent analysis and understanding. In approaches that utilize the art modality for treatment, the process of creating the artwork is evaluated and rated manually via self-reports, questionnaires and forms, if at all. For example, focusing mostly on the finished artwork. Attempts have indeed been made to computerize partial information and post-evaluation of the end product, but they do not deal with the dynamic process of its construction. Recording of a few particular parameters, based on predetermined hypotheses is done in music as well as for dance. All in all, Events and time durations are likely to be missed if relying on the human observer or on the end product. Understanding the underlying mechanistic behavioral processes of arts-based approaches in action is required. This is true, in particular, of the quantitative identification of moments of change or turning points in the clinical session, their causality and measurements of change processes. We develop a broad computational paradigm, which is designed to allow rigorous and quantitative capturing of the underlying creation and interaction behavioral processes, and their objective analysis and documentation. Our technology centers on modeling the dynamics in the visual language of state charts. State charts were invented by Professor David Harrell over 30 years ago, and ever since, are successfully used in modeling complex systems in diverse scientific and industrial fields. We apply our novel technology, in real-world experimentation, to study emergent behaviors of humans in response to arts use. This will allow us to reveal the underlying mechanisms by which arts-based approaches and interventions operate, and eventually, to evaluate and predict treatment progress and outcome, and their amelioration. The introduction of our novel methodology, and its use in a proof-of-principle artwork study with human participants, was recently published in the scientific journal, PLOS One. The contents of this publication will be presented here next. That is, preceding the description of the motivation for our research as we just did. Next, we will describe the computational paradigm in great detail, and our artwork study and the significant results we have obtained. We will also briefly discuss our future goals. Our presentation of the computational paradigm will include an overview of the methodology's architecture, that is, the description of the components comprising out modeling and analysis-based technology, and the information flow between them. Preceding this description, we will discuss modeling considerations which lead us to model the system with state charts. Then after, we will present the models of our system, that is, the arts room. Our technological suite consists of the model tracking module, responsible for capturing the dynamics of the systems modeled, for example, the artwork or the patient. It is input by digital means, for example, tablet touch screens, video and audio. The analysis module, responsible for investigating emerging individual and collective behaviors teased out by the use of art. The documentation module, which transforms the expressive and social emergent behaviors into a format imaging the arts session's occurrences. We will now describe this in greater detail. Since the naked human eye cannot rigorously and objectively capture and document the observed behaviors of the system studied, we are using digital means to do so for the initial raw data. That is, digital, non-human observations. For example, tablet touch screens for the artwork creation, keyboard for musical work, and later on video and audio, for digitally observing the dance work, the therapist and patient. The digital information is then decoded and fed into the tracking component of our paradigm, the model tracking module, which hosts the state charts based model of the explored system and its specified metrics. For example, the model of the artwork system and its defined parameters and metrics, which will be described in detail in the next section of our talk. The features we are currently marking in yellow specifically relate to the implementations carried out for our proof-of-principle artwork study. The model tracking module generates quantitative emergent individual and collectives behaviors that are the input to the analysis module, which is study-based. That is, the emergent behaviors stemming from the model tracking module are analyzed per study. This is done using mathematical, computational and algorithmic means, for example, statistics, data mining and optimization, depending on the study at hand. Also, the analysis module enables one to carry out exploratory, hypotheses-generating and knowledge discovery investigations, which are empirical-based. Our proof-of-principle demographic artwork investigations with human participants will exemplify all these. The emergent behaviors obtained are also output using our documentation module, which is developed for portraying the dynamics of the processes explored. This is done by composing textual and visual reports, as well as graphical charts, to convey the properties of the dynamics of the creation processes given in an accurate and non-verbal manner, which is easy to perceive. Furthermore, digital recordings of the dynamics allow the processes to be played back and reproduced for repetitive inspections. We will show these later on. We wish to facilitate and create standardization in the reporting of patient cases and behavioral patterns, in session comparisons and in the documentation, retrieval and sharing of information. And eventually, we aim to develop a domain-specific language. That is, an appropriate formal language will be devised to represent the dynamics of the clinical sessions domain. Once an agreed-upon language is introduced into a profession, it enables ever-growing opportunities of communication and understanding between specialists and communities of the domain's relevant fields. 3 major entities comprise the arts room or the clinical settings: the creation work, for example, the artwork, musical work or dance work, the patient and the therapist. These components and their interactions constitute a dynamic system that continuously reacts to internal and external stimuli. Internal stimuli are exemplified by the ongoing art creation and the patient's choices therein. An example of an external stimulus is the therapist's intervention. Such systems have been termed reactive. Within the reactive system of the arts room, the creation, construction work itself is considered a reactive subsystem, driven by stimuli of events. Such events include, picking up a drawing medium, such as a paintbrush or a red-colored pastel crayon, starting to draw a stroke, and stopping. These events transfer the system from state to state, for example, materials being selected, to artwork being worked on. The state-event approach, that is, the use of states and the events that trigger transitions between the states, is an idea that has been used since the earliest days of describing computation. It was given a boost in the 1980s, with the advent of Statecharts for specifying the behavior of complex reactive systems. Statecharts are a visual formalism, which enriches the basic state-event approach with means for describing hierarchy, that is, nested states, and multi-level transitions, as well as orthogonality, which means concurrent states, and more. Statecharts constitute an intuitive, yet mathematically rigorous formalism. Statecharts has broad applications in software and systems engineering, healthcare processes, automotive and aerospace, biological modeling, and more. We base our modeling method on Statecharts, and its underlying execution and analysis tools, as we describe next. We modeled the creation and interaction dynamics of the art room using Statecharts. The artwork, patient, client and therapist, the 3 main entities composing the art room, function and operate in parallel. Thus, as shown in the Statecharts diagram, they are depicted as concurrent states: artwork, client, and art therapist, represented by dashed lines and encompassed by their parent superstate, art room session on. The states art room session on and art room session off are represented by solid lines, and are mutually exclusive. The arrows represent the state transitions, and are labeled with events, which are recognized throughout the Statechart model, and cause the transitions. Thus, the event session status toggles between art room session on and art room session off. The artwork is the center of creation in the art room and can exist without the need for a clinical setting. In this panel, the artwork state is decomposed into its substates: material selecting, painting, and idle. The exclusive substates of artwork model are the modes the creator or patient can be in, vis-a-vis his or her artwork. The creator enters the painting state on the event of starting a stroke on the canvas. The state of painting is left when the stroke ends, that is, the drawing tool is lifted up from the canvas. At this point, the creator enters either the material selecting state, by selecting new tools or colors, or the idle state. Exiting each of these states and entering the others is triggered by the successive events. The internal dynamics while in the painting state is rich, as seen in this panel. Here we use the concurrent orthogonal states: material selected, stroke characteristics, and page views. All three are active simultaneously when the artwork is being created, accounting for concurrent occurrences that are rather difficult to follow with the human eye, but are made plausible by the orthogonality construct of Statecharts within the tracking model. Within these states there is further decomposition into substates. The material selected state, for example, is modeled by a range of color and tool choices that specify the current stroke being executed. The attributes specifying the canvas color and texture occur in parallel, and here their options are fixed. The stroke is also tracked for its drawing direction, or gradient, the pressure exerted by the tool drawing it, and its size and velocity. These attributes are modeled as concurrent, simultaneous states within their stroke characteristics parent state, and each of these is further described by exclusive substates. For example, considering the velocity state, the velocity of the drawn stroke can be high, medium or low, depending on conditioned threshold values, appearing along the transition arrows. The gradient is modeled in a compass-like manner, determined by the angle of the stroke. It is also important to track and analyze the page views in terms of the locations of the stroke. The page divisions of interest are the 4/4 division, top left, top right and bottom right, and the 2 parts division, center and boundary. A stroke is thus in states quarters and parts in parallel, and within these it is characterized by the exclusive substates. In addition to the artwork model we have just described, zooming in the high-level states of the system, as part of the therapy room hierarchy, we also see the substates composing the client and therapist. That is, the client and art therapist concurrent orthogonal state entities and their auditory and bodily states therein. These states are narrating social interaction via the patient and therapist models. For example, facial expressions, body postures, body language, physicians in the clinic room, the therapist's interventions, and more. In general, these state entities also apply to other forms of arts therapy, for example, in modeling music therapy. The use of Statecharts serves as a formalism for both, modeling the system, and designing a test bed for behavior capture and performance analysis, as we will see in the artwork study described next. We show the methods use of the artwork model application in a real-world art-making study with human subjects. First we will discuss the rationale for focusing on the artwork in this proof of principle study. Then, we will demonstrate the use of our computational paradigm and its applicability to the artwork study. We will describe the actual setting for the investigations, that is, the setup, the subject population, and the study procedures which include the drawing tasks the subjects participated in. We will then show the results we have obtained from analyzing individual and collective emergent behaviors, that is, arising properties and patterns of the decoded behavioral processes in response to the drawing tasks. Art-based approaches can be carried out along the continuum of art, as therapy, and art in therapy. The former notion assumes that the art making is the therapeutic process itself and thus, the artwork is the focus of attention. In the latter, the therapist guides and intervenes, trying to initiate changes, for example, utilizing guided imagery, which is a cognitive behavioral intervention, and hence, the therapist-patient interaction is also considered a focus of attention. This is why the artwork focuses the first step prior to the exploration of the contribution of therapist-patient interaction. Our study, carried out with healthy normal subjects, focuses first on the art making and the artistic creation dynamics therein. An example of artwork construction dynamics will be seen next. Since the naked human eye cannot rigorously and objectively capture and document the observed behaviors of the system studied, we use digital means to do so, for the initial raw data. For example, tablet touch screens on which human subjects draw. The digital information is then decoded and fed into the tracking component of our paradigm, the model tracking module. This module is responsible for capturing the dynamics of the systems modeled, for example, the artwork. The model tracking hosts state charts based model of the explored system, and its specified metrics. State charts are visual language, which allow to uniquely formulate the states and events of the system. The model tracking module generates quantitative emergent individual and collectives behaviors, that are the input to the analysis module, which is study-based. In this module we employ mathematical, computational and algorithmic tools to investigate the data obtained, as dictated by the study's aims. The emergent behaviors obtained, are also output using our documentation module, which is developed for portraying the dynamics of the processes explored. This is done by composing textual and visual reports, as well as graphical charts, to convey the properties of the dynamics of the creation processes, given in an accurate and non-verbal manner, which is easy to perceive. We will now show how the dynamics of the artwork creation, which appear on the upper left side of the screen, are decoded to states and events, and tracked by our Statecharts model appearing on the right side window. For example, states such as painting, idle, and material selecting. Running this collection of artwork construction excerpts, you can see the substates of specific tools and colors used, for example oils in red or green, watercolor in blue and next, pencil in orange. Concurrently, on the bottom left-hand side of the screen, the pressure exerted on the current tool is displayed, as an example of one of the parameters being monitored throughout the artwork construction. We also track and show dynamics of erasure. See how the pressure changes, and the number and the gradient of the erasure strokes required to erase the object. Our method's artwork model captures and decodes emergent behaviors and includes 1. Measuring exact time durations of occurrences within the art session, for example, net idle time in which the creator or patient is not engaged in art activity, and net drawing time, in which she or he is. 2. Tracking erasure periods and their time durations, as well as the usage of other drawing tools and color choices, their preference profile and cross-sections therein. For example, colors palette per drawing tool, and also capturing and analyzing the switching frequency of colors and tools. 3. Capturing the characteristics of hand movements or strokes, for example, jumpy, sharp, smooth, repetitive, etc., and calculating the drawing velocity, direction, amplitude, and pattern, for example, circular, clockwise or counterclockwise, as well as the number of strokes generated, their total accumulated length, average size, and pressure exerted on the drawing tool and the erasure. 4. Tracking the drawing page or canvas usage in time and space area, analyzing the art-making process, for example, whether it is carried out in a confined area, say, page corner or section, on the page boundaries or in its center, and also whether the drawing process involved crossing the page more horizontally or more vertically. Here we show visualization of the artwork construction dynamics by the documentation module, which generates a visual report of the dynamics of an artwork progression, displaying rigorous tracking of events and states of the artwork over time. For example, stroke start and stroke end, the color and tool used for the stroke, its location in the page, that is, in which quarter and whether in the boundary or center, the drawing pressure and direction. The idle periods are clearly seen, as well as erasing epochs of drawn objects. Snapshots of the artwork creation appear along the parameters temporal plotting. Illustration of the interpretation of the visual report appears in Panel B, which enables the reconstruction and formation sequences of objects in the artwork. The documentation module also outputs the textual report of the dynamics of an artwork progression, showing the quantitative tracking and analysis of an artwork's creation specified by the parameters and their cross-section calculations. This gives precise temporal information, which also accompanies the visual report. That is, in addition to the metrics measurements calculated, the color and tool profiles are also calculated per metric, and their crossovers distribution, for example, drawing time over color and tool, their stroke distribution, drawing velocity, and drawing pressure exerted. Within the analysis module, we carry out our investigational artwork study in which we are interested in exploring the artistic expressive behavior of the participants in response to drawing tasks, and quantitatively comparing the dynamics of their creation processes. In addition, we wish to study the collective behaviors of the participants segmented into gender and age groups, where here, the creation processes are investigated and analyzed for discovering significance in the dynamic attributes, that is, of the state's profile and metrics calculated. For example, the duration of time a color or a drawing tool is used, erasures periods, the velocity of the drawing strokes, the stroke's accumulated length, page usage, and more. The art media the participants used was a computer tablet, and they drew using a stylus pen on a customized screen for the study. The participants chose from a palette of 10 colors: yellow, red, blue, orange, violet, green, black, white, pink and skin. They had a choice of 6 drawing tools: pencil, pastel, oils, watercolor, ink pen, and eraser. All colors can be chosen for all tools. The drawing page, canvas, has an off-white yellowish color, in order for the color white to be visible. All these are also depicted by panel B, showing the diversity of chromaticity, materials generating texture, and other real-world feel effects, such as blending and mixtures. 12 participants comprise the subject population, of whom 6 were male and 6 were female, with an age mean of 38.8. The participants had no formal art training or professional painting experience. They all came from similar cultural and academic backgrounds. Each participant was asked by the experimenter to produce artworks for 4 drawing tasks, to be consecutively carried out one after the other. The drawing tasks were not limited in time. The first task was a warm-up. The individual was asked to choose a single color and draw a line with this color by each of the drawing tools. In the second and third tasks, the subject was asked to express in drawing, a positive and a negative feeling, respectively. For the fourth task, the individual was asked to draw an image of a house, a tree, and a person. Next, we will present the results of the artwork study. The artwork focus is the first step prior to the exploration of the contribution of therapist-patient interaction. Our study, carried out with healthy, normal subjects, focuses on the art making and the artistic creation dynamics therein. The resulting artworks are presented here, with each participant's work being arranged in a column from top to bottom, categorized by gender, age, and drawing task. This is the end product of a participant who drew an image of a positive feeling. Here we show as an example, the artistic emergent behavior of an individual participant, asked to draw an image of a positive feeling. We revealed that the end product of the positive feeling image of had changed during the course of its construction. Our tracking shows that the house drawn next to the human couple in was totally erased and a colorful field of flowers was drawn instead. Erasures, for example, took a notable portion of the drawing time, around 34%. These were carried out with the high pressure of with fast hand movements and the high velocity of 8.6 cm per second, well above the average of 6.8 cm per second. In this drawing, the pencil was the only tool that was not used. Here we exhibit the artwork of the same participant who drew an image of a negative feeling. Analysis of the image of the negative feeling drawing shows that the black mass was created by fierce and lengthy vertical movements, and with growing pressure. Most of the page was covered by 4 black strokes of the pastel color, with the drawing medium rarely lifted up from the page for the entire session. One of the things made possible by our computational approach is to compare the creation processes of several artworks. The table displays how this is achieved for the dynamics of the previous 2 drawings. The quantitative comparison therein shows clearly that whereas the positive feeling image is an expression of a narrative or symbolic elements, the negative feeling image is an abstract composed by contiguous movements in black. Out of the total session time of each artwork, The positive image actual drawing consumed 41% of the time compared with the 85% the drawing time of the negative image. The latter artwork covering 96% of the page and 1/5 of the total session time, compared to the positive one. Being carried out with an average velocity that was 5-fold higher than that computed for the positive image, the negative image has a total stroke length twice longer than that of the positive image, but required only 2% of the number of strokes of the latter. As shown earlier, tracking the creation dynamics also allows us to discover important phenomena that are otherwise missed when examining only the end art product. For example, in one of the positive feeling drawings, our computations show the use of white 65% of the drawing time, although this is not seen in the final drawing. Examining the reports of the creation of this particular artwork reveals that the participant had been blending in the white color in repetitive circular motions for most of the drawing time. Another interesting example is of one of the house tree person artworks, where erasures consumed 46% of the drawing time. The reports and playback reveal that the participant had modified the house twice and the person 6 times, changing the colors, tools, forms and dimensions of these images, until the final output was produced. This provides valuable information, for example, for evaluation and diagnosis, as well as for understanding the overall dynamics of creating images. It would most probably not have been properly noticed if the dynamic process was not tracked and documented. We were able to obtain gender and age significant results, exploring collective behaviors for demographic differences. These include the findings that the drawing velocity of females was almost twice that of males, whereas males used the color blue and the pencil tool around 3 times more than females, and overall used more drawing tools. The method is designed to have all the findings empirically and accurately measured and hence comparable. As an example, the drawing velocity of females is 11.7 cm per second versus the 6.6 cm per second of the mean with p-value of 0.0084. When analyzing specific drawing tasks, we obtained that in the negative feeling drawing task, for example, the males switched between tools 3 times more than the females, that is, 16.7 tool switching for males and 5.7 for females. This is consistent with the observation that females were busier drawing, since their velocity is almost 4-fold higher than males. In the house tree person study, the average stroke size, for example, was found to be also gender significant, with that of females being almost twice longer than males, 5.1 centimeters for the females versus 2.7 centimeters for the males. Additional gender differences can be found in the table presented here. Although females used fewer colors than males, 47% versus 51%, respectively, they switched between them more often than the males, 5.1 switches per color for females and 3.5 for males. Females drew around 1,569 centimeters in total length of strokes, in comparison to the males' 990 centimeters. And using fewer strokes, 246 versus 262, respectively. Compared to males, females also exerted less pressure whilst drawing, with a 6-degree bottom right shift in the average drawing direction, and used 5% more page space area. Notably, is the session's drawing time percentage spent in the upper left quarter one for females, 19%, which is the less preferable one of the 4 quarters. The less favoring one for males is the upper right quarter 3, 16%. Females having 137 horizontal and vertical strokes crossovers compared to the 93 of males, that is, 47% more strokes crossing to adjacent quarters. The significant results related to age include the findings that the participants in their 50s erased almost 3 times more than the ones in their 20s, whereas the latter used more colors. These gender and age significant hypotheses may point to factors that account for expressive variation impacted by art use, which can be further explored on larger scales. In general, our future goals are: we plan to develop our computational paradigm to allow the intra-analysis, local analysis, and micro-analysis of a session, for example, where the focus is on specific moments within an arts-based session dynamics, as well as inter-analysis, global analysis, and macro-analysis, with reference to wider perspectives, across sessions, individuals and collectives. Developing and using our computational paradigm, we further wish to generate broad and novel scientific and clinical discoveries, and to improve their usage in arts-related fields.